description. So you're sitting in your outpatient department and you're working as a registrar in acute medicine. A 25-year-old patient comes to your OPD and gives a history, 2 days history of central chest pain, a fast heart rate or palpitations, and shortness of breath. His father accompanies the patient and says that he is worried that the patient may be having a heart problem. He says that whenever he walks a little bit on the ground, he gets short of breath occasionally. You do a clinical examination and you find out that he's not cyanosed, no bluish discoloration of the fingertips. His blood pressure is normal, about 120 by 80 millimeters of mercury, and pulse rate is 120 beats per minute, although it's regular. Oxygen saturation is 95%. And when you listen to the chest, you find out bilateral equal air entry, no wheeze or crepitations. So that's a little bit of recap. Patient is not cyanosed, blood pressure is normal, oxygen saturation is 95%. There's no obvious wheeze or added sounds on auscultation of the lung. So on percussion of the lungs, there isn't any dullness of percussion or no hyperresonance, which excludes any pneumothorax or any consolidation. Auscultation of the heart reveals normal heart sounds, no murmurs are appreciable. The tongue is fine in color, red color, no central cyanosis, no peripheral edema of the feet is present. So basically on clinical examination, you don't find any specific abnormality. However, the heart rate is a bit fast, 120 beats per minute. And the pulses on both sides, so both right and left radial pulses are quite palpable. So now you decide to move on a little bit more further and you organize a chest x-ray and an ECG. So this is the chest x-ray and this is the ECG. Now here are some questions for the discussion. What are the findings on the chest x-ray? That's question number 1. Question number 2, what are the findings on the ECG? Question number 3, given the history, which single sinister or critical condition needs to be excluded out first? And question number 4 is, what is the most likely diagnosis given the history? It's a 25-year-old young man who has presented with shortness of breath and central chest pains. So although he has mentioned in the history that he gets short of breath on exertion, here the history is of sudden onset of central chest pain, tachycardia, and shortness of breath. One other thing that I need to mention is that on clinical examination, apart from this fast heartbeat or tachycardia, the length of the patient or the height of the patient is more than average people. So he's a bit tall in length as compared to his father as well, is tall in size, and there's no smoking history. When you ask the patient about history, there's no, he doesn't smoke at all. So this is the first lecture about this case history, and we will be discussing about further differential diagnosis and possible diagnosis in the next lectures. Thank you for watching and see you soon. Bye.